Welcome to the series to preserve, protect, and defend the soul of America. Today's topic is the American healthcare system, unaffordability, medical bankruptcy, and why the U.S. stands alone, a nation sick with its own cure. We're examining a tragic paradox right at the heart of contemporary American life. The United States spends more money on medicine than any nation in human history. It trains some of the finest physicians and researchers in the world, and it houses the most technologically sophisticated hospital systems on Earth. And yet, it routinely destroys the financial lives of the very people it treats. It's a nation sickened by the very system meant to heal it. To really understand the uniquely American stakes of falling ill, consider two diagnoses separated by an ocean. In 2019, a woman named Laura was diagnosed with ovarian cancer in Columbus, Ohio. Her treatment generated bills totaling just over $200,000. Even with health insurance, after her insurer paid its share, Laura was still left with approximately $32,000 in out-of-pocket costs. Lacking savings of that magnitude, she filed for bankruptcy. Now, that exact same year, a woman named Ingrid was diagnosed with the identical cancer in Stockholm, Sweden. Her treatment was similarly aggressive and similarly successful. But Ingrid paid a copay of roughly $100 under Sweden's high-cost protection threshold, beyond which all healthcare costs are covered entirely by the state. She didn't go bankrupt, she didn't lose her home, she wasn't ruined by the very disease that tried to kill her. While these are composite portraits built from statistically accurate patterns, their stories capture an unadorned, harrowing reality. Laura's fate introduces a concept that is exclusively American: medical bankruptcy. We're talking about personal financial ruin filed primarily because of medical bills or the income loss resulting from serious illness or injury. Now, among the 40 nations classified as high income or developed by the World Health Organization, the United States stands remarkably and frankly embarrassingly alone in permitting this tragedy. It stands apart not by accident, not by poverty, and definitely not by a lack of knowledge about what works elsewhere. It stands apart by choice. Part 2. An architecture of accidents. How the system was never built. To grasp how these choices were made, we have to look to history. The American healthcare system was never, in any meaningful architectural sense, actually designed. It wasn't built in the way a legislative body establishes principles and then constructs institutions to embody them. Instead, it's an architecture of accidents. It accreted through historical improvisations, the strategic maneuvering of competing interest groups, and the defeat of every single serious attempt at comprehensive reform over more than a century. What Americans call a healthcare system is much better understood as layers of policy written over policy. Back in the progressive era of the 1910s, the first serious movement for compulsory health insurance emerged, inspired by European models. It was fiercely defeated by a coalition of the American Medical Association, insurance companies, employers, and even organized labor. Later, when Franklin Delano Roosevelt crafted the Social Security Act of 1935, health insurance was deliberately excluded, just to prevent the American Medical Association from dooming the entire package. The foundation of the system was never replaced. New patches were simply layered right over the old failures. The most consequential layer of this makeshift foundation was born purely out of wartime necessity. During World War II, the federal government imposed wage controls to prevent inflation. In 1943, the War Labor Board ruled that employer contributions to health insurance plans fell outside the definition of wages. Suddenly, employers who were unable to offer higher pay started offering health coverage just to attract scarce labor. Congress later codified this into the tax code, exempting these premiums from taxable income. This single bureaucratic accident created the massive scaffolding of employer-sponsored health insurance we still use today. It tied health coverage directly to employment, meaning losing a job means losing your health care precisely when you might need it most. It distributed risk unevenly, and it built a massive constituency of employed workers who had a vested interest in protecting the status quo, which effectively stalled future universal reform. Part 3. It's the prices, stupid. The anatomy of unaffordability. This historical accretion leaves us with a system of staggering complexity. But if history explains how the system was assembled, it doesn't fully explain why it costs so much. For that, we have to shift our focus to raw economics and the true anatomy of unaffordability. Look closely at the data. In 2022, the United States spent approximately $12,500 per person on healthcare. That's roughly twice the average of comparable nations like Germany, which spends about $7,000, and nearly 3 times that of Japan, which spends $4,500. The standard cultural narrative usually attributes this to American medical innovation, but research proves otherwise. A landmark study published in Health Affairs summarized the reality with a stark phrase: "It's the prices, stupid." Americans don't utilize more healthcare than their global peers. They don't see doctors more frequently or have more hospital admissions. They simply pay phenomenally, almost incomprehensibly, higher prices for the exact same services. A massive driver of these astronomical prices is the complete absence of national price negotiation. In virtually every other developed system, the government plays a central role in setting or negotiating the prices that providers can charge. In the United States commercial market, there is no such framework. Instead, prices are set through bilateral, secret negotiations. Consequently, the rapid consolidation of American hospitals into massive health systems has allowed them to function as regional monopolies. Where hospitals face little or no competition, they can dictate rates. Research consistently shows that hospital mergers are followed by price increases of 20 to 40%, entirely without any commensurate improvements in the quality of patient care. Beyond hospital pricing, there is an invisible cost weighing down the entire system: $812 billion. Take a moment to let that number sink in. This is the estimated annual cost of billing and insurance administration in the United States. It's a staggering expenditure that produces exactly zero medical benefit. The layered, multi-layer hybrid system we've built, featuring hundreds of private insurers alongside Medicare and Medicaid, requires an extraordinary administrative infrastructure. Hospitals and physician practices have to navigate an endless maze of disparate formularies, prior authorization requirements, network tiering, and complex billing codes. This administrative complexity consumes approximately 34% of total U.S. healthcare expenditures, compared to just 12.4% in Canada's single-payer system. It diverts immense resources away from patient care and drives rampant clinician burnout, literally forcing physicians to spend nearly twice as much time on administrative tasks as on treating patients. The structural failures extend right into prescription drugs. Pharmaceutical pricing in the United States represents a deliberate political bargain. For example, the Medicare Modernization Act of 2003 explicitly prohibited Medicare from negotiating drug prices with pharmaceutical manufacturers. This legislative restriction means the single largest purchaser of pharmaceutical products in the world must pay whatever the manufacturer demands. The result is that a drug like Humira costs over 4 times more in the United States than it does in Germany. Part 4. The Catastrophic Cascade: Medical Debt as a Mass Phenomenon. The consequence of unchecked prices and administrative waste isn't merely statistical, it's deeply personal. We have to return to the human toll to truly understand the sheer scale of the financial devastation inflicted upon the American public. 100 million. Pause for a second and consider the immense gravity of that number. As of 2022, 100 million Americans, nearly a third of the adult population, carried some amount of medical debt. Approximately 12 million Americans owed more than $10,000. Medical debt is the leading cause of personal bankruptcy in the United States, and it constitutes the largest single category of debt in collections, surpassing credit card debt, student loan debt, and auto loan debt combined. A pervasive myth suggests that medical bankruptcy is a plight only suffered by the uninsured. The data forcefully demolishes this assumption. Studies demonstrate that 75% of individuals who were bankrupted by medical bills actually had health insurance at the time of their illness. High deductibles, substantial copayments, and massive out-of-pocket maximums offer nothing more than an illusion of safety. In America, even comprehensive-seeming insurance coverage can leave a middle-class household with financial obligations measured in the tens of thousands of dollars. The financial ruin triggers a catastrophic cascade. Bankruptcy damages credit scores for a decade, making housing and employment incredibly difficult to secure. It forces the liquidation of life savings, home equity, and retirement accounts. It shatters families, with financial stress serving as a highly powerful predictor of divorce. But most perversely, it destroys health. Patients drowning in debt consistently forego follow-up medical care, they fail to fill life-saving prescriptions, and they avoid critical diagnostic testing. A cancer patient who cannot afford continued treatment due to debt faces worse survival odds. Put simply, the financial toxicity of the American healthcare system literally kills people. Recognizing this failure requires us to see it as an additional layer of a much deeper, systemic divide. The burden of this system is deeply unequal. The American medical system was racially segregated for much of its history, and the legacy of that exclusion absolutely persists today. Medical debt and mortality disparities reflect and reinforce centuries of structural inequality. Black Americans experience higher rates of mortality from virtually every major cause compared to white Americans with comparable incomes. The geography of medical debt heavily penalizes Black and rural Americans, particularly in southern states where political decisions to refuse Medicaid expansion have left millions uniquely exposed to both financial ruin and early death.
Part 5. The World's Other Ways. The International Mirror.
This domestic catastrophe is not an inevitability of modern medicine. When we hold the American system up to the international mirror, it becomes starkly clear that this crisis is a choice. The international experience demonstrates that universal coverage is entirely achievable at lower costs with better health outcomes. The United Kingdom utilizes the Beveridge model, spending just $4,200 per person, providing free care at the point of service through the National Health Service. Germany utilizes the Bismarckian model, spending roughly $7,000 per person through highly regulated social insurance funds. The United States utilizes a fragmented multi-payer system, spending $12,500 per person, all while leaving millions vulnerable to bankruptcy. Other nations achieve universal risk pooling, administrative simplification, and lower costs through mechanisms the U.S. simply chooses to ignore. Part 6. The Iron Triangle. Why reform consistently fails. If the solutions are so well documented, why does the nation remain locked in this catastrophic status quo? The answer lies in the political economy of the system. An iron triangle of industry influence, ideological warfare, and embedded cultural barriers that consistently crush meaningful reform. $693 million. This is the staggering amount the healthcare industry spent on federal lobbying in 2022 alone. The American healthcare system generates approximately $4.3 trillion per year in revenue. For the industries extracting that wealth, hospitals, insurance companies, and pharmaceutical manufacturers, protecting even a fraction of that revenue stream makes massive political investments entirely rational. Their lobbying expenditures significantly exceeds that of any other sector in American politics. But industry money operates behind a powerful ideological shield. Back in 1949, when President Harry Truman proposed a moderate national health insurance program, the American Medical Association hired a public relations firm to run an unprecedented campaign against it. They weaponized a single phrase: socialized medicine. This phrase entered the political vocabulary as a highly reliable kill switch for reform. It created a rhetorical framework where any government role in healthcare financing is characterized as an existential threat to freedom. This ideological framing systematically obscures the material interests of the healthcare industry, making clear-eyed empirical discussions about policy nearly impossible. This propaganda succeeds because it taps into deeply embedded cultural barriers. American political thought is steeped in frontier individualism and a profound suspicion of state administration. Furthermore, the employer-sponsored system created a cultural framework where healthcare is viewed not as a human right, but as a moralized reward for work. Today, extreme partisan polarization has accelerated this dynamic, turning healthcare policy into a tribal marker rather than an empirical pursuit. While the Affordable Care Act of 2010 expanded coverage to millions, it left this fragmented, hyper-expensive architecture largely intact. The foundational flaws remain untouched, and the financial bleeding continues. As long as health is treated as a commodity rather than a right, the American system will remain a machine that generates immense wealth at the absolute cost of its citizens' physical and financial survival. So, the question remains, are we willing to continue paying this price? This comprehensive explainer is derived from the first book of the massive 30-volume series To Preserve, Protect, and Defend the Soul of America. The book is titled Volume 1, America's Healthcare Crisis and Broken Public Institutions, authored by Sue B. Howell. It is available to purchase in all Amazon bookstores worldwide right now. To follow our continued explainers of these critical issues, please subscribe and press the bell icon to get notifications.